reported her injury to the hospital the day after the incident. That's on the 18th, and was further treated. There was no evidence of fracture on her left wrist or dislocation of her right shoulder joint as documented by the medical records.
Let's understand this, right, Joshua?
Yes.
You have a video
where
there was a slap
by
the
on
same
the
Ralph.
Yes.
Where have you seen that video? Because I haven't seen.
All right, guys, the Rich Assaults Investigation Committee has presented their findings to the Health Minister, Kobena Minta Akando, following the 17th of August 2025 incident at Greater Accra Regional Hospital Emergency Department. In fact, there are a lot of the committee presenting the documentation of their findings or an investigation to the Health Minister. Whilst there are other also updates which is now popping up. In fact, and questions are asking. The PRO of Rich has gone to GH1, say that she has a video which Ralph came to spoke about it, but the PRO is saying that I have a video where Ralph slapped a pregnant woman's face. In fact, these are a lot, so this video you can't afford to miss it. Follow my page if you're first time coming across DF channel, Facebook, YouTube DF.channel, TikTok DF channel. Let's center into the matter now.
DF channel, not so life. B.
The report that presented to the Health Minister, in fact, a very long document, 4 to 8 pages, with also a pen drive. I think that should be a video with their findings or the investigations of evidence that was released, and I believe there are a lot inside that particular pen drive or on that particular pen drive. So this actually made me to think that, okay, I think Ralph knew what he was doing. So, and I think if not because of Ralph, they wouldn't have come to Rich, or they wouldn't have formed a committee to do investigation and findings at Rich. And where I think they say they have a lot of machines which is not function at Rich. And so staff are not even enough at Rich. This one I don't understand. I don't know whether the nurses and doctors at Rich know that there's a problem in the hospital when it comes to the machinery that they use for work, and they are not saying, or they also spoke about it and then there were no response. Or it is a political something I don't even understand. Yeah? In fact, we'll get to the bottom of this. 48 pages. To be sincere of you, I will not be able to read this. In fact, there are videos to back it. We'll listen to the video instead of going through the document, because if I to go through the document, all these 48 pages, as we'll have a lengthy video here. I mean, my worry was for the nurse. If she was hit and there were a lot of fractures, or maybe she was assaulted physically, and then I was actually blaming Ralph. But with the findings and the investigation shows that there was no physically assault or dislocation and all these things, all fractures in her.
Was further treated. There was no evidence of fracture on her left wrist or dislocation of her right shoulder joint as documented by the medical records. She was, however, had been treated at the time we visited. Had been given some pain relief. It has been recommended for a bed rest and also has received psychological support care. The third objective, the state of security at the hospital at the time of the incident. Honorable Minister, the committee finds out that the security at the emergency department was grossly inadequate at the time of the incident. The hospital security arrangement of one private security personnel per 12-hourly shift at the emergency is inadequate, considering the volume of human traffic at the Greater Accra Regional Hospital emergency. A police post that is found at the premise of the hospital but situated far away from the emergency is also of concern. And the system is that anytime they have such altercation, the hospital has to rely on Adabraka Police Command to call for help. And that's exactly what happened in this instance. The last but not the least objective was that the committee also found that the number of staff on duty per shift in the hospital was woefully inadequate. The number of medical officers in the month of August is 1 doctor per shift. That's 3 medical officers per day who are permanently working in emergency, supported by 1 specialist per day. Any other doctors who come there as a team to attend to cases and go away.
There was no dislocated or anything, so they treated her and give her psychology training, or if you want investigation, to actually know whether she's fit very well. But seems with their funding and everything, she was fit.
Honorable Minister, apart from the 4 main things, there were other findings that we want to bring to your attention. The committee also visited the nurse in question, the rotation nurse, Ms. Chocho Rejoice, who was alleged to have been physically attacked and was receiving care at the hospital. When the committee visited, indeed, we saw the patient in bed. The document available to us from the medical record, as I already said, had no indication of fracture or dislocation of the said staff.
I think that when you listen to the video, there they were interviewing her. It's like they were, I don't know, whether somebody was coaching the lady to do this.
She was aided by somebody who might have planned this whole thing. And you can hear when he was talking, the guy that was holding the mic was the one even directing her, dislocated. And you can watch from the video, you can see from the video, when she was talking, she wanted to even stop her from moving the shoulder so that people wouldn't see that, no, and so I dislocated in our casa moving. So you can see his hands trying to stop the girl, and he himself, so say, Akwawi or a smart power or Shadia power, I monitor everything. Right? So those that aided her to do this, and this is a criminality. And whoever that supported her, planned this whole thing with her, for her to, come up with this drama, which could have sent me to jail if there were no evidences or if this investigation was not probed into. Again, this guy came and threatened the whole country that if I am not being arrested, they are going to go on a strike, inciting the youth to go against the labor law.
So now Ralph is calling for contribution to sue the lady because physically, I'm sure that spiritually, he has already done with that one. And then any amount of money given to him should be accounted for.
Anybody who is ever willing to support us, raise funds to sue these people physically, it is part of fighting for the system. Let's donate to support. Let's raise these funds to support. Every single money that comes in will be accounted for. It is solely for the movement. We need to save the next generation. We need to sanitize our system. We need to make sure that Ghana works again.
Also give an advice to the good nurses. In every profession, it's not everyone that is bad. Yeah. So he advised the good nurses, the unpolluted, because I have a lot of nurses around me, friends, family members.
To our good nurses out there, be good. Work diligently as you're responsible, as the Constitution acquire you, as your oath of office required of you. And eyes are watching, ears are listening. Gadgets will be recorded. Gadgets will be recorded. Eyes will be around all hospitals that we can reach to. We only need funding to be able to. Funding is the only thing that we need now, so that we will be able to take this up to the last battle. Whoever that incited, whoever that helped instigated this, whoever that is a member to this should face the law.